Welcome to In the Know with Empowerment Nursing. I'm Ashley and I'm a nurse educator. And this week we are applying In the Know and we're going to do some respiratory questions. So if you didn't catch our Facebook Live this week, that's okay. We invite you to come back and view that, where you can see how the logarithm of the NCLEX determines a pass or a fail. And feel free to participate in this question by commenting in the comments below what your answer would be. So we're going to talk a little bit about COPD in our question here. When administering oxygen to a patient with chronic obstructive pulmonary disease, or COPD, it is important to make sure to titrate the oxygen you administer in order to prevent A, obstructive apnea, B, hypoventilation, C, hyperventilation, or D, respiratory alkalosis. A lot of you probably know that we do put oxygen on COPD patients, but we start low and we go slow, but there's a reason why, and this is getting at, do you actually know the reason why behind us not overflowing a patient with COPD? The reason why is B, hypoventilation. We want to prevent hypoventilation or low respirations. And this is because COPD patients rely on something different to breathe. In an average individual like myself, for example, I don't have COPD. My regular drive for breathing is dictated by high levels of CO2 or high levels of acid in my body. So when my CO2 level in my blood gets to a certain level, I'm driven to take in another breath and to exhale. However, COPD patients have high levels of acid all of the time, right? They have high levels of CO2. They're called CO2 retainers. So their body gets used to having high levels of CO2. So instead of relying on high levels of CO2 to take a breath, their body relies on low levels of oxygen to take a breath, okay? So when their oxygen gets low, they breathe. So if we put oxygen on them, they're no longer going to have that low oxygen drive to take a breath. So if we put too much oxygen on them, they won't take a breath because they lose their body's natural cue, if you will, to respirate. So in order for us to prevent that from happening, we have to titrate their oxygenation very, very slowly to prevent hypoventilation or a loss of their drive to breathe. So that is the actual rationale around not overloading COPD patients with oxygen. So for the answer to this question and more, you can access our complete study package through our website. And thank you so much for joining me, and I'll see you next time on In the Know with Empowerment Nursing. Bye for now.